What I'm about to tell you about the pills sitting in your medicine cabinet right now is going to completely change the way you think about your kidneys, because there's a very good chance that one of the most common medications you take every single day is silently destroying the very organs that keep you alive. I'm Dr. Eric Berg, and for the past 30 years, I've been helping people just like you reverse chronic disease using root cause science most doctors never learned in medical school. And today, I'm going to walk you through 5 extremely common pills you can buy without even seeing a doctor, that are quietly damaging your kidneys. Now stay with me, because the number 2 pill on this list is something nearly 30 million Americans take every single day, often for years, without ever being warned about what it's doing to their kidney function. I'll reveal it in just a few minutes, but you need the full picture first, because without it, you won't understand why this is so dangerous. Let me paint you a picture. You wake up in the morning a little more tired than you used to be. Your ankles look slightly puffy. You notice you're getting up to urinate 2-3 times a night. Maybe your blood pressure's creeping up. Your skin feels itchy for no reason. Your appetite isn't quite the same. And when you go to your doctor, they run a basic blood panel and tell you everything looks fine, but you know something is off. Here's what they're not telling you. According to the Centers for Disease Control, over 35 million American adults, that's about 1 in 7, have chronic kidney disease right now, and 9 out of 10 of them have absolutely no idea. The National Kidney Foundation has confirmed this repeatedly. By the time your standard creatinine test flags a problem, you've often already lost 50, sometimes 60% of your kidney function. 50% gone silently, while you were taking pills you thought were perfectly safe. You've done everything right. You drink your water, you try to eat better, you follow the advice you've been given. But nobody, and I mean nobody, sat you down and explained that the over-the-counter pills you grab without a second thought are filtered through these 2 small, fist-sized organs in your lower back. And every single time you swallow one, your kidneys have to process it. This is critical. I want you to understand this. Your kidneys filter about 180 liters of blood every single day. They are the most overworked filter in your entire body, and we treat them like they're indestructible. They're not. Now, for decades, you've been told that over-the-counter medications are essentially harmless. Your doctor probably told you to just take something for the pain. The pharmacy aisle is stocked floor to ceiling with these pills, completely unrestricted. But here's the problem. That perception of safety is based on outdated thinking from a generation ago, and the modern research is telling us a very different story. A landmark study published in the journal Kidney International found that long-term use of common painkillers significantly increases the risk of chronic kidney disease, even in people with no prior kidney problems. Research from the American Society of Nephrology has shown that acute kidney injury from over-the-counter medications is now one of the leading causes of emergency hospital admissions for people over 50. And a 2021 review in JAMA Internal Medicine highlighted that the more medications you take simultaneously, what doctors call polypharmacy, the higher your risk of permanent kidney damage. The research is very clear on this. These pills are not as benign as the label suggests. So let me walk you through the 5, and I want you to listen carefully, because you or someone you love is almost certainly taking at least one of them right now. Number 5 on the list, the common heartburn pills, the ones called proton pump inhibitors. You've seen them everywhere. They're sold over the counter. People take them for years and years without thinking about it. Here's what's actually happening in your body. A major study published in JAMA Internal Medicine followed over 170,000 people and found that long-term use of these acid-blocking drugs was associated with a significantly higher risk of chronic kidney disease, and in some cases, kidney failure. Researchers at Johns Hopkins Medicine confirmed similar findings. Now here's the thing. These drugs were designed for short-term use, maybe 2 weeks, but people stay on them for 10, 15, 20 years. They also deplete magnesium, B12, and calcium, which puts additional stress on your kidneys, your heart, and your nervous system. Let me explain why this matters. When you suppress stomach acid, you don't actually fix the problem. You just mask it. And in the meantime, your kidneys pay the price. Number 4, the common cholesterol-lowering medications, the statin class. Now, I want to be very careful here, because I'm not telling you to stop any prescribed medication. That's between you and your doctor, but you deserve to know the truth. Research published in the American Journal of Cardiology and follow-up studies indexed in the National Institutes of Health database have shown that statins, particularly at higher doses, can cause acute kidney injury and worsen kidney function in vulnerable patients. They also deplete CoQ10, which your kidney cells absolutely need to produce energy. After 30 years of clinical experience, I can tell you, I've seen this pattern over and over again. Patients on these medications for years develop kidney issues that nobody connects back to the pill they take every morning. Number 3, the common antibiotics, especially a class called aminoglycosides and certain broad-spectrum ones. According to the Mayo Clinic and Cleveland Clinic, antibiotic-induced kidney injury is one of the most common causes of drug-related kidney damage in hospitals. But here's what almost no one talks about. Even the antibiotics you take at home for a sinus infection or a UTI can stress your kidneys, especially if you don't drink enough water, or if you take them repeatedly, or if you're over 60. Antibiotics also obliterate your gut microbiome, and emerging research from the National Institutes of Health is now showing a direct gut-kidney axis. When your gut bacteria are wiped out, inflammatory compounds leak into your bloodstream, your kidneys have to filter them, and chronic low-grade inflammation sets in. This is the part nobody talks about. Now we get to number 2, and this is the one I really need you to pay attention to. This is the pill that nearly 30 million Americans take every single day, often without thinking twice. I'm talking about the common over-the-counter pain relievers known as NSAIDs, the anti-inflammatory pills you take for headaches, back pain, muscle soreness, arthritis, menstrual cramps, sore knees. You know exactly what I'm talking about. They're in every household in America. And here's the truth that the label barely whispers. The National Kidney Foundation has been sounding the alarm on this for years. NSAIDs reduce blood flow to your kidneys by constricting the tiny blood vessels that feed them. A study published in the New England Journal of Medicine and multiple follow-up studies in Kidney International have shown that even short-term, high-dose NSAID use can cause acute kidney injury, and chronic daily use is associated with permanent loss of kidney function. I see this all the time in my patients. Someone with knee pain takes one of these pills every single day for 10 years. They have no idea their kidney function has dropped by 40%. Their doctor never warned them. The bottle never warned them clearly enough. And here's what's truly frightening. Combine NSAIDs with high blood pressure medication, or with dehydration, or with the heartburn pills I mentioned earlier, and the risk of acute kidney injury multiplies dramatically. This is why number 2 is so dangerous. It's not the strength of the pill, it's the frequency, it's the assumption of safety, it's the fact that nobody told you. And number 1 on the list, the common decongestants and combination cold and flu medications, particularly those containing pseudoephedrine and certain antihistamines. The American Heart Association and research published in the journal Hypertension have shown these can spike your blood pressure significantly, and elevated blood pressure is the second leading cause of kidney failure in this country, right behind diabetes. When you take these pills repeatedly during cold and allergy season, year after year, you're putting sustained pressure on the delicate filtering units in your kidneys called nephrons. And once a nephron dies, it does not grow back. Let me say that again. Once a nephron is gone, it is gone forever. You have about 1 million of them per kidney, and you've been quietly killing them for decades. So what do you do about this? Here's where I want you to take action. First, you need to stop assuming that over-the-counter equals safe. Read every label. Talk to your doctor about every single pill, including the ones you buy without a prescription. Second, you need to support your kidneys nutritionally. Your kidneys absolutely love foods rich in potassium, magnesium, and antioxidants. Leafy greens like arugula and watercress, wild-caught fatty fish, avocados, berries, and pumpkin seeds. Researchers at Harvard T.H. Chan School of Public Health have repeatedly shown that diets rich in plants and healthy fats are protective against kidney decline. Third, get your magnesium up. Most Americans are deeply deficient. Magnesium glycinate, taken in a therapeutic amount appropriate for your body, helps relax blood vessels and supports kidney filtration. Fourth, consider vitamin D3 with K2. The research on vitamin D and kidney health is overwhelming. Low vitamin D is directly linked to worsening kidney function. Fifth, hydrate properly with mineral-rich water, not just tap water. And add a pinch of high-quality sea salt to support electrolyte balance, especially if you're fasting or low carb. Sixth, ask your doctor for a deeper workup, not just creatinine, but cystatin C, a urine albumin to creatinine ratio, and your eGFR trended over time. These three together give you a much clearer picture than the standard test alone. And seventh, this is critical. Start walking after meals, just 10 to 15 minutes. This single habit improves blood sugar, lowers blood pressure, and reduces the kidney strain caused by metabolic dysfunction. Dr. Benjamin Bickman's research on insulin resistance and Dr. Jason Fung's work on metabolic disease both confirm just how powerful this simple intervention is. Now, I promised you at the beginning that I'd reveal the number one thing most people are doing every single day without realizing it. Here it is. It's not just one pill. It's the combination. It's taking your blood pressure medication in the morning, then a heartburn pill at breakfast, then an anti-inflammatory for your sore back at lunch, then a cold medication when allergy season hits, then a sleep aid at night. Each one on its own may seem manageable, but stacked together, day after day, year after year, this combination is what silently destroys kidney function in millions of people, and almost no doctor sits you down and maps it out. This single realization, when my patients understand it, changes everything. They start auditing their medicine cabinet, they start asking better questions, and within 90 days, their kidney markers begin to improve. Your kidneys are not invincible. They are quiet, they are patient, and they will keep filtering for you long after the damage has begun. But they cannot speak, so you have to speak for them. If this video helped you, do me a favor, share it with someone you care about, because chances are they're taking at least one of these pills right now and they have no idea. And if you want to go deeper, I have another video where I break down the foods that actually heal your kidneys. I'll link it for you right now. You don't want to miss it. Remember, your body has an incredible ability to heal itself when you give it the right inputs and remove the wrong ones. I'm Dr. Eric Berg, and I'll see you in the next video.